Today, we're going to take a journey deep inside the heart's electrical system to get a handle on a really fascinating and serious condition called long QT syndrome. So let me ask you something. What if an alarm clock could stop your heart? I know, it sounds like something straight out of a thriller movie, right? But for some people, a sudden, startling noise, yeah, like an alarm clock, can actually trigger a life-threatening event. This isn't fiction. It's a very real clue to a hidden rhythm disorder in the heart. To really get what's going on, we need to talk about something called the QT interval. The easiest way to think about it is as the recharge time for your heart's muscle cells. See, after they contract to pump blood, they need just a fraction of a second to reset before the next beat. It's this crucial, perfectly timed pause. Okay, so to understand what happens when things go wrong, let's first take a quick look at how the heart's rhythm is supposed to work. Just imagine your heart has its own biological wiring. It's this super intricate network that sends out tiny electrical signals telling the heart muscle exactly when to squeeze and when to relax. And when this system is working like it should, we get a steady, reliable rhythm, something we never even have to think about. But what happens when that rhythm gets thrown off? Well, this is where long QT syndrome, or LQTS for short, enters the picture. For people with LQTS, that recharge time, that QT interval we just talked about, is longer than it should be. And that delay, that little bit of extra time, can throw the heart's timing completely out of whack, leading to chaotic and really dangerous heartbeats called arrhythmias. It's a genetic condition, and it affects about 1 in every 2,500 people, which actually makes it one of the more common inherited rhythm disorders out there. Now here's the thing. LQTS isn't some one-size-fits-all condition. As you can see here, the 3 most common types are caused by mutations in different genes, and this is the really key part. Each one has its own unique trigger. Understanding this link between the specific gene and what sets it off is absolutely crucial for treating the disease. So for someone with LQT1, the biggest risk is during physical exertion. We're talking about activities like swimming in particular. That rush of adrenaline from exercise can dangerously stretch out their already long recharge time. Then you've got LQT2. And yeah, this is the one we were hinting at with the alarm clock. For this type, the trigger isn't exercise, it's a sudden surprise or intense emotion. You know, an alarm clock blaring, a phone ringing in the middle of the night, or a sudden scare. And LQT3 is almost the complete opposite. For people with this type, the danger is at its highest when their heart rate is low, so that's typically during rest or even while they're asleep. It's a much quieter trigger, but it's no less serious. So if the wiring is faulty, what do we do about it? How do we manage it? Well, current treatments are actually highly tailored to the specific type of LQTS a person has. For decades, the first line of defense has been a class of drugs you've probably heard of called beta blockers. They work by basically shielding the heart from adrenaline. This helps stop those triggers we just talked about from causing a dangerous arrhythmia. But this is exactly where precision medicine becomes so important. Check this out. A big meta-analysis showed that not all beta blockers are created equal. A drug called nadolol is highly effective for both LQT1 and LQT2. But another common one, propranolol, while it's pretty good for LQT1, is way less effective for LQT2. This is a perfect example of why knowing the specific genetic type is a total game changer. Right, so the main takeaway here is that you've got to tailor the treatment to the gene. While nadolol is a fantastic choice for LQT1 and 2, beta blockers just aren't as effective for LQT3, where a slow heart rate is the problem. For those patients, a totally different drug called mexiletine, which targets sodium channels, is often a much better choice. Now, for patients who are still at high risk, even with medication, or for someone who's already survived a cardiac arrest, there's another layer of protection, an implantable cardioverter defibrillator, or an ICD. This is a small device that's implanted under the skin. It acts like a constant watchdog, just monitoring the heart, and it's ready to deliver an electrical shock to get things back to a normal rhythm if a dangerous arrhythmia starts. It's truly a safety net. Okay, so managing symptoms is one thing, but what if we could actually fix the faulty wiring itself? Well, that's exactly where the future of treatment is headed. You know, researchers are making some pretty incredible strides in gene therapy. The strategies get really complex, but we can kind of boil them down to 3 main ideas. 1, you can try to replace the broken gene with a working one. 2, you can try to silence the faulty gene so its bad instructions just get ignored. Or 3, and this is a really clever hybrid approach, you can suppress both the faulty gene and the healthy one and then replace them with a new, healthy copy that's resistant to the therapy. It's just mind-blowing, cutting-edge science. So, while inherited LQTS is a really serious condition, the story of the QT interval doesn't stop there. Actually, its relevance extends to a much, much wider group of people, sometimes in ways that might surprise you. It turns out you can also acquire a prolonged QT interval, and often it's a side effect of very common medications. We're talking about certain antibiotics, certain antidepressants, even some anti-nausea drugs. They can all affect the heart's recharge time. This is what's known as drug-induced QT prolongation. And this brings us to this really powerful statement from the NHS. It just perfectly captures the whole idea of personalized medicine. Your unique genetic makeup, what other meds you're on, your overall health, it all plays a role in how you might react. What's perfectly safe for one person isn't always safe for another. And let's end on a really hopeful and very recent update. This comes from an NIH-supported study. For years, people with LQTS were told to avoid sports and vigorous exercise. But new evidence, fresh from 2024, suggests that for patients who are being treated, either with medication or an ICD, vigorous exercise does not seem to increase their risk of a cardiac event compared to people who exercise moderately or not at all. This is a potentially life-changing finding for so many people. Which leaves us with this final thought. We've gone from just managing symptoms to tailoring drugs based on a person's specific genes, and now we're right on the cusp of maybe fixing the genes themselves. So as our understanding gets deeper and our tools get more and more precise, you have to wonder, could we one day intervene and correct the heart's hidden rhythm before it ever has the chance to miss a single beat? Thanks for watching.